Hi, my name is Jessica Allen. I'm the physician assistant injector at our North Raleigh location, and I've been with Synergy for just about a year now.
My name's Ashleigh. I'm the nurse practitioner at Synergy's Cary location. I've been with the company for a little over a year. Today, Jessica and I are going to talk a little bit about Botox and filler and how the two treatments complement one another.
First, we're going to go over Botox and filler individually and talk about the separate areas that we like to treat. So first, we're going to talk about Botox. Botox is a neuromodulator that's used to relax muscles, which then smooths lines and wrinkles on the face. Most patients are really good Botox candidates. Botox is not used on patients that are pregnant or breastfeeding and those patients that have some specific neuromuscular disorders. Botox typically will last about 3 months. It starts to wear off and you see some movement at 8 to 12 weeks. When we're talking about Botox, dosing is specific and customized to each patient that we see. Botox units specifically, dosing equals duration. Patients typically come back at 12 weeks and we can take pictures and repeat the dosing if needed. Areas that we use commonly to treat Botox, we can break it down between upper and lower face. So looking at our model here, we commonly use Botox on the forehead or frontalis. So I'm going to have our model raise her eyebrows and we can see the wrinkle pattern here. Each patient's wrinkle pattern and Botox dosing is very different. The next area is what patients call the 11 lines or the glabella, which is actually a complex of muscles. So I'm going to have her make an angry face down and we can see the pulling of the muscle here. These two muscles are connected. So when you see your provider during a treatment, most oftentimes we'll recommend treating your frontalis and your glabella as one complex since they work together. The next area that we commonly treat is around the eyes. Just turn your head to. These are called crow's feet. For us, they're called lateral canthal lines. So I'm going to have the model close her eyes really tight. So these lines here are the lines that we would treat with Botox. Oftentimes when we treat the lines, crow's feet, we also treat the glabella. That whole complex when treating will open us up and make us look more refreshed and smooth lines and wrinkles. There's another muscle that is also connected to the glabella, and that's our nasalis, and that muscle is across the nose. So I'm going to have our model kind of sniff like she's smelling something. So those lines here are called our bunny lines. That's from the nasalis. So those are our areas in the upper face where we like to treat with Botox. Lower face Botox, we actually have quite a few areas that I think some patients are not usually familiar with. So first, I'm going to have her show us her mentalis by pouting out the lower lip. This dimpling can be smoothed with Botox. You can relax. That dimpling isn't just present with that facial expression, but oftentimes as an injector, we can see that as we talk to the patient and as they express, and sometimes even with chewing, you'll get the dimpling. So Botox is very, is a good area here to smooth the lines and wrinkles. The next area in the lower face, I'm gonna have our patient grimace. So right here, this area, there's some lines. Although we use Botox here at this muscle called our DAO muscle because it brings the corners of the mouth down. When we inject this area, it straightens out the corners of the mouth. So it doesn't really so much help lines and wrinkles, but it helps to improve the function of the muscle so it doesn't make us frown at rest. Some patients come in with a gummy smile. So when they smile really big, can you smile big for us? And our model really doesn't have one, but sometimes our lip can elevate over the teeth and show a lot of the gum line. In that case, we can put some Botox in both of these muscles here, and that just relaxes the upper lip to cover the gum. So these are common areas in the lower face that we use Botox. The last place that we would consider Botox is in the neck area for the platysmal bands. So I'm going to have our model kind of grimace really hard down. And right here, this is the platysmal band. So in here as well, you can relax. So by injecting Botox in the platysmal band, it smooths out the neck and it stops pulling in the lower face. One last area in the lower face that we can treat is the masseter muscle. We have one on each side of our face. When the masseter muscle is large and bulky, it can cause discomfort with clenching and grinding, and it can also kind of widen or give us a square looking jaw. We inject Botox in both of those muscles, and it can slim the jaw. Typically, Botox in a masseter takes at least 3 weeks to kick in and lasts for about 4 to 6 months. Otherwise, Botox administered on the rest of the face takes about 3 to 7 days to kick in, fully kicked in at 2 weeks, and should last approximately 12 weeks.
Fillers are gel-like substances used to restore volume in the face as well as reposition ligaments, providing structural support. Most fillers that we use here are made of hyaluronic acid, which is naturally occurring in our joints and our skin. Results, depending on the filler you use, typically last 1 to 2 years. Most people are generally candidates for filler, but the treatment plan is going to vary depending on your age, your gender, and your personal anatomy. Some of the most common areas we treat are start with the cheek, just to add some structure to the face, helping to support ligaments that start to elongate as we age due to bone loss and skin laxity. Treating the cheek, you can create a little bit of a contour and then provide a little bit of mid-face volume support. As we age, we start kind of losing volume in the mid-face. So adding some filler can kind of support this. So our model is fairly young, so she doesn't have a very pronounced nasolabial fold or marionette lines. But in an older patient, when you add a little bit of cheek filler, that can help improve the look of the under eye, the nasolabial fold, and marionette lines if the patient has them. You can use some fillers to kind of create a more pronounced jaw or kind of fine-tune the jawline if it's needed. And then adding a little bit of filler in the chin, depending on its natural shape, can feminize the chin and provide a nice balance to the profile. Lip fillers are also very common, especially in younger patients, but in older patients it can help with perioral lines and smooth lip texture. So it all just kind of depends on how the patient presents. So now Jessica and I are going to talk a little bit about Botox and filler during the consultation process. So Jessica's going to start with the upper face.
So on our model today, what I'm going to do is treat her frontalis, so raise your eyebrows up to help smooth the lines and wrinkling. I'm going to treat her glabella, with the angry face, to also smooth lines in her frontalis because the glabella is really strong. We're going to treat around her eyes as well, those crow's feet that we talked about. That's going to open her up and make her look more refreshed and is going to complement really nicely what Ashleigh is going to plan on doing with her filler today.
With our models, mid-face, we're going to start with her cheeks, just kind of adding, the goal mainly is for mid-face volume restoration. So we're going to add some fillers to her cheeks, possibly get a little bit more of a contour, although we want to be careful we don't make her look hollow. And then also adding a little bit of filler to her piriform, which is just the space by the nose. That's going to help also to support the cheek and help to soften the nasolabial fold. We're going to add a little bit of filler to her chin, just a little bit right in the middle, just to kind of create a nice heart shape and balance the profile.
And for her lower face with Botox, to complement the filler, we're going to add some treatment to her upper lip for a lip flip to help balance out proportions in her profile. And we may also treat the DAO muscle, or the muscle that's pulling the edges, the corners of her mouth down, to soften that area as well.
All right, we're going to get all set up and we'll see you back here for the treatment. now that we've completed our filler segment, Jessica's going to take over and talk about Botox.
So first what we're going to do is cleanse our model's skin, and then I'm going to go ahead and treat her forehead, glabella, lateral canthal lines. We're going to do a little lip flip to complement the chin filler, and we're also going to treat her little DAO muscles that pull the corners of her mouth down. So I'm just going to go ahead and start by drawing and marking, and then we'll get started with the injections. With the Botox today, we treated forehead, 11 lines, crow's feet, did a lip flip, and then also treated the DAO muscle, which pulls down the corners of the mouth.
We also did fillers, starting with our model's lateral and medial cheek, the piriform aperture to help support that, and we took it down just to do a little bit in the chin.
Using Botox and filler together, we've given our patient a comprehensive treatment that was customized specifically for her anatomy, and for her aesthetic goals. Thank you so much for attending our session today. For additional information, go to our speaker bios and click Request Follow-up. If you're ready to purchase, head to shop and purchase Botox as low as $10 a unit and save up to 30% off a filler.
Be sure to enter code DYNAMICDUO to receive points for attending this session.
Thank you.